I'm sure we've all either had or known someone who's had chickenpox.
To begin, what is chickenpox? Chickenpox is a highly contagious disease which is caused by a virus named varicella zoster. Chickenpox can be serious and life-threatening to babies, children, pregnant women, and people with a weak immune system. This infectious disease often affects young children between the age of 5 to 9.
It is a disease which can infect others through contact and air. Chickenpox spreads from person to person by direct contact, like touching the blisters, saliva, or mucus of the infected person. The virus can also be transmitted to others through air. When the infected person sneezes, coughs, or talks, the pathogen-containing droplet sprays into the air and may infect others who breathe in the droplets.
So, how do we know if we have chickenpox? The classic symptom of chickenpox is a rash that may first show up on the chest, back, and face, and then spread over the entire body, including inside the mouth, eyelids, or genital area. Other typical symptoms that may begin to appear 1 or 2 days before the rash are fever, tiredness, loss of appetite, or headache. Once the chickenpox rash appears, it goes through 3 phases. First, raised pink or red bumps called papules break out over several days. Then, small fluid-filled blisters called vesicles form in about 1 day and then break and leak. Lastly, crusts and scabs cover the broken blisters and take several more days to heal. These symptoms start appearing 10 to 21 days after exposure to the virus. Full recovery from chickenpox usually takes 7 to 10 days after the symptoms first appear.
You might be asking, can chickenpox be cured? Well, chickenpox usually resolves within a week or 2 without treatment. There is no cure, but a vaccine can prevent it. The chickenpox vaccine protects against the varicella zoster virus, which is the virus that causes this disease. For children, 2 doses of the varicella vaccine are given, one at 12 to 15 months and one at 4 to 6 years. The chickenpox vaccine is a live vaccine which contains a small amount of weakened chickenpox-causing virus. The vaccine stimulates your immune system to produce antibodies that will help protect against chickenpox.
And lastly, to prevent further spread of chickenpox, people infected with the disease should remain home and avoid being exposed to others. These infected people should stay quarantined until the blisters have decreased. It is very important to avoid exposing small children, babies, and people with a weak immune system to those infected.
So now you know all there is about chickenpox. Spread this information to others so you and your loved ones can be protected from this infectious disease.